Hello, everyone. This is Dr. Khan. Welcome to another Facebook Live. It's a pleasure to have a special guest all the way from across the Atlantic from Scotland, and pleasure to hear your experience so that you share with us your journey. I just want to go ahead and start off by saying, I have had at least 10 of my friends reach out to me and say, these are plastic surgery colleagues, what are you doing? This is where the surgery that you're doing is dangerous, involved, challenging, long. And I said, don't listen to me, listen to my patients, because it's your words, versus the rest of the world, if you will. And this is your experience and this is what you went through, so that when we look back at your surgical experience, your post-op course, we can say with absolute certainty what is the course that you went through, and it's black and white, it's very clear. So if you can please go ahead and introduce yourself and let us know where you're from.
Hi everyone, my name is Lynn and I'm from Scotland in the UK.
Yes, no, it's always a pleasure to have someone. I say this whenever I operate. I have had patients from other parts of the world. They are as human as the Americans, and the human body is the same. There is no boundaries. We hurt in a similar way. Now, let me ask you this. When did you get your implants?
It was 2003.
2003,
yeah.
And you got what were silicone implants?
Silicone implants.
Now, what's interesting is back in 2003, silicone implants were banned in the US. You could only get them as an experimental study, meaning if you signed up for with a trial, and then you could get the implants. Now, tell us about your journey. What led you to realize that breast implant illness is what you were going through?
Mainly the symptoms. I was initially fine, I would say the first 6-7 years of having the implants. And then about 7 years onwards, I started to feel really, really tired. The type of tiredness I just couldn't shake. Back and forth to my GP, the doctor, and all the blood works always came back normal, but your body, something's not right, and I just knew something wasn't right. But this went on for years and years and years, and then I had, other symptoms like palpitations, leg aches. It was awful. It was.
So this is now almost 2012, let's say 2000, and so all these years, you're like looking for answers. So what type of doctors did you go to?
So I was referred to cardiology because I had palpitations. I seen a gastro specialist because I ended up being diagnosed with IBS. Just different GPs, just different doctors that I seen, just always said, it's just you're doing too much. You've got 2 young children, you just need to take it easy. But I was like, I just feel exhausted all the time. It was just no matter how long I would sleep, I would get up and I'd want to go back to my bed about an hour later.
So this is the most common complaint that the patients have. If I've talked to 1,000 ladies, the most significant common complaint is feeling tired all the time. Even after 8 hours rest, the patient's like, I could go take a 2 hours nap, and there was no energy, the lack of energy. And this is what the young moms and even the 78-year-old lady that came, the thought process here is you're old, there's the stressors in life, you're premenopausal, you're just too stressed out. And unfortunately, the implants are not even in the equation. Now, so all these, now you're looking at from 2012 onward, at what time did you kind of put the 2 and 2 together? It was the implants.
I started doing a bit of research, and then I had heard about BII, and I thought, I wonder if this is what I'm suffering from, because it does make sense.
Right. When was this roughly?
This was roughly about 2014, I would say.
Wow, okay, so that early on, wow.
Yeah,
okay.
it was,
9 years ago.
Yeah, absolutely, and I had went back and forth again to my doctor, and I even discussed BII, and they hadn't heard of it. And they said, look, there's no evidence that it exists, we don't know a great deal about it. Again, we'll take your bloods, got bloods taken, back normal. Away again, I was working full time at the time, and I had to reduce my hours to part time. I just could no longer do full time hours. It was just taking over my life, totally debilitating.
So you're reading up on this now. Back in 2014, this is almost like 9 years ago, 10 years ago. it started to come out, because those patients who had gotten implants, at least in the United States in 2007, when the implants were reintroduced into the market as safe, the complaints started coming out. And usually, anecdotally, 7 to 10 years is when the problems start arising. So there's like an initial quote, if you will, the honeymoon period where you have like a nice time experience. But then remember, they're not lifetime devices. The problems arise. So the textbooks and the literature says 10 to 15 years, but from my experience, anecdotally, 7 to 10 years. Now you're looking at BII and you've been to your GP, who's a general practitioner, and they're kind of brushing you off. And when did you really start saying, okay, this is what I need to do next?
Yeah, so I was about 49, so that was 3 years ago, and I thought these need to come out because I started doing more research, and I thought the tiredness was getting worse, and I thought these implants need to come out. So I had read up that they really should have been replaced 10 years ago. And I thought, wow, these are 10 years overdue, basically. So I had went back to the doctor and I says, look, I want...
This is your plastic surgeon back home in Scotland?
Yeah. No, it was my GP. And they referred me to the plastic surgeon. And they done a mammogram and they done an ultrasound, and they thought there was maybe a rupture in the right implant. So they said, okay, we'll put you on the waiting list, because it was through the National Health Service. And it'll be like, a three-year waiting list before you'll get your surgery.
Wow.
Yeah.
For an explant.
Yes.
Well, this is Canadian medicine too, right there.
3 years. So I said, is that safe if there's a rupture, especially in the right breast? And they're like, yeah, that should be okay. So I went to see the plastic surgeon, and he discussed it all with me. He says, we've got you on the waiting list.
So you waited, how long was it before you even got to see the plastic surgeon?
So I waited about 3 months, and then I went to see him. So I was coming up for 50 at the time, and he says, right, you'll be about another 2.5 years on the waiting list. He says, we think you've got a right rupture. He says, that's okay.
How did he say that?
He said, because he looked at the results of the mammogram and the ultrasound, and he said, it looks like you've got a right rupture. He says, but I'm not certain.
Right. So I just want to mention, the ultimate way, the best imaging modality is an MRI without contrast. And the ultrasound is kind of sound waves, technician dependent, better than nothing. It's not the best test out there. A mammogram's job is to look for calcification, breast cancer, be it screening or diagnostic. So that's not the right exam either. And this is where, if I may, according to the guidelines, this is the instructions. This is what we are told. This is the black box warning. And then at the bottom, I'm going to read verbatim, quote, MRI screenings are recommended 3 years after initial implant surgery, and then every 2 years after to detect silent rupture, close quotes. So they are saying MRI. They didn't say a good plastic surgery exam, because no matter how talented the plastic surgeon is, you cannot tell if it's ruptured. The ultimate way is the MRI. And unfortunately, a very small subset of patients get an MRI because it's expensive. It's a relatively long process, and the patients have to incur the costs. And so unfortunately, now one thing that you mentioned, which was very interesting, that your plastic surgeon said that there's no urgency into.
Yes, he wasn't concerned, and I said to him, I'm worried if there's a rupture there. I said, that's a bit long to wait, 2 to 3 years. And he says, oh, it'll be fine, it'll all be contained within the capsule. He says, don't worry about that. And I says, so then that's when I had said to him, when you're doing the surgery, I want the end block. I says, I want the capsule removed. And he says, no, he says, I can't guarantee I can do that. He says, I could puncture your lung. He says, I do not want to put that risk. He says, it's too risky.
Right. Now, so this is true. So if you group together, let's say, 1,000 plastic surgeons, and this is the general consensus by the European Plastic Surgery Board, Canadian and the United States Board, that this surgery is too dangerous, too risky. We were on a conference call with another plastic surgeon who, believe it or not, had 9 pneumothorax that punctured. Now, this is not for everyone, and I would, say that, this is definitely the hardest part. Now, I will say gladly that I have had only one almost 7 years ago, and that was my first and only one. Now, if the surgery needs to be done, it needs to be absolutely done in the right manner. Otherwise, don't do it, right? Because you don't want to do an incomplete job. And in this case, incomplete means letting the silicone spill into the chest. The second thing is it's long. You bet it is long. Should you not do a surgery because it's long? No, we do surgeries that are 20 hours long. You know, the longest one that I was involved with was 24 hours. Now, this is reasonable, 4 hours plus minus. And the other was the fact that the capsule need not be removed. Guess what? In your case, had the capsule not been removed, they would have had a ruptured implant on the right chest.
Yeah.
Now tell us, you also had pain on the right chest.
Yeah.
When did you have the pain on the right chest?
After my mammogram.
Oh,
Yeah.
after the
Yeah,
mammogram.
I had no pain up until I had all the symptoms, but no pain.
Yeah. So, you know, one thing that I want to read here, and again, these are not my words. I did not write any of this. These are not, you know, if you want, we can share this with you. These are the recommendations to improve patient communication, breast implants, certain labeling recommendations to improve patient communication, FDA. And as you will see, you have the black box warning. You know, first thing it says, breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. So that in itself alone was a reason that for you to get an explant. The fact that you have pain is in itself alone is a reason. So as you will see, it says over here, the outline right here, and I'm going to read, quote, I understand that all breast implants can interfere with mammography and breast exams, which could delay the diagnosis of breast cancer. Mammography can also cause the breast implant to rupture or leak. I should tell the mammography technician if I have breast implants. The other thing I want to read here, which is important, I understand that silicone can migrate from an implant into nearby tissues, for example, chest wall, lymph nodes under the arm, and organs, liver, lungs, where it may not be possible to remove. Now, this is a big deal, which means that, you know, it's being shown, and if you look at the studies that have been done, even a saline implant, the shell of which is silicone, can leach out small silicone particles from what is an intact saline implant, even though it's not ruptured. An intact silicone implant, not ruptured, will also leach out particles into the capsular tissue. And it's been shown that that leaching will occur even if the saline implant is intact, silicone implant is intact, and if it's a ruptured implant, it will leach supposedly more. Now, and this is intuitively, because remember, there is no shell, and now it is an intracapsular rupture, which is what was your case. And so the point here is that you have this leaching phenomenon that's occurring and into the periphery, and we want to remove not only the implant, not only the capsular tissue, but the inflamed tissue around from a good heart, that a sincere heart, because that's where your recovery lies.
Yeah.
Now, so you were hurting. It's very interesting after, because remember when you get a mammogram, you're putting the trauma of the mammogram onto the implant, which is very likely ruptured and now causing the pain. Now, how did you, now you did your research, you talked to your plastic surgeon in Scotland. What other research did you do that led you to me?
So I was on Facebook one day and you came up, and I kind of started Googling breast implant illness, and on Facebook, Instagram, places like that, and I came across yourself, Dr. Khan, and I just kept going back to you because I don't know, you ticked all the boxes for me, to be honest with you. It's been a long journey, you know, from Scotland to Michigan. It's been a stress for the last couple of years, even just trying to get here. But I'm so glad I've done it. You just ticked all the boxes. I just started doing more research. I had a few consultations with different surgeons back home, and it just didn't feel right.
What did not feel right?
They just weren't you. They weren't compassionate. They just didn't seem to care the same. I mean, when you phoned me for the consultation, you were on the phone for over an hour, and I just thought that speaks for itself. You really understand where us women are coming from, you know. So yeah, just the empathy you've got, and you know, it's just I didn't get a good feel for the surgeons back home.
Right. No, see, the thing is, this is a surgery where if you go to 100 different plastic surgeons, all 100 of them are going to do it differently on their own job training. Now, this is the hardest sell. there's two conditions to an explant: that the surgeon has to believe from his mind and his heart that the breast implants are the problem and that all the capsule needs to be removed. And so that belief has to be super strong, unshakable, and fully established, because that's your post-operative recovery. The other thing is that the surgeon should be able to carry out the process of the surgery. The other thing is, when you look back, and this is what I said in the Facebook Live, I could not have done the surgery any better, because there was the en bloc, complete total removal, and I removed even part of the cartilage of the rib in order to, and you see that on the Facebook, because that's what it entailed for me, to removing the whole capsule completely, sincerely. This is where I did not know going into your case that the right side was going to be ruptured. And lo and behold, to my total surprise, it was ruptured and everything was contained. And God forbid, if anything comes back, you already have had your surgery all done below the muscle, directly on top of the rib, which was indeed a very hard part of the case. The right side took twice as long as the left. But no matter what, this surgery is not about speed. It's all about precision, the ultra care, and such that the capsule must be removed. And if the en bloc was not done, that ruptured implant would spill into the chest. And no matter how much you clean it out, that silicone would basically bathe the soft tissues and then travel even more so to the other tissues, because then would have been free floating silicone. Now, how many hours did you spend researching me or breast implant illness?
Hours. Honestly, it was like an addiction. I was constantly
I like that.
Yeah, honestly, because I knew myself. I had to go for the en bloc surgery. It was a no-brainer, and I knew I wanted to come to yourself. But I researched for hours.
Did you look at any other surgeon here in the United States?
There was a few other surgeons, yeah, I did, but again, I kept coming back to yourself.
So the other thing I want to mention here, and this is the second take-home message, the first one is the en bloc. Because if the en bloc was not done, you would have had free-floating silicone in your chest, and that would be a catastrophic advantage. The second thing is, your surgeon has to show a video and a picture of the chest wall, like I showed you, complete removal of the implant capsule and all inflamed tissue. Part B is what happens on the table, but part A, where you show the chest wall, showing complete removal of the capsule, that there is no capsular tissue remaining behind, and all of that inflamed tissue capsule has been removed, that video must be produced. I'm going to say it again. Your surgeon must show, because if it was not shown, it was not done. No good documentation. I have had another patient that I did a consult on. Her surgeon did it under local. You can guarantee that you're not going to get the right surgery. You do not want to be also in a situation where you say, well, I'm going to give it a shot. If I don't improve, then I will come to Dr. Khan. No, you do not want to do it. You want to do it right. You do want to do it once. Because had you had a ruptured implant spill into the chest, that would be a big catastrophe. So your surgeon has to show the video and high definition video and chest wall pictures showing complete removal of the capsule, and number two, cutting open of the capsule. And I want you to see that high definition video and picture, and I want you to get the op note. I saw another operative note from another surgeon, prominent explant surgeon, who did not write in the operative report that he did an en bloc. And she, another prominent surgeon, she did not do an en bloc, or she did not remove the whole capsule. And I said, how can you do a supposed explant and not even mention that the total capsule was removed?
Absolutely.
And they keep that verbiage out. So you have to see this, you have to see this. And ideally, your surgeon is not augmenting, because if your surgeons are augmenting, how and why is this surgeon potentially harming? As you can see, from 2014, every year, every day, every hour, more and more patients are realizing we have, another celebrity's daughter, Charlie Sheen's daughter, who went online. She did her own research. 3 years into her augmentation, she is convinced and realizes that she has the implants that are hurting her. Now, let me ask you this next question. As you made the trip and you came over, and you have the nicest husband, if you will, how sure were you that this surgery was going to help you?
I just knew. I just knew, yeah. I just have total faith in you. Yeah, I just knew. And I was feeling that ill even coming over. I just had to get these implants out. I just had to get them out. And I just had faith in you, Dr. Khan. I just knew I was going to get better. and I feel great. I actually feel.
Yeah. So what have you noticed? Now your surgery was just 4 days ago.
Yeah.
I just want to mention that, yes, it's been 4 days, but there's a lot of improvement, especially when you have a grade 4 capsular contracture.
Yeah.
Please tell us, and remember, this is very preliminary, very early, but I tell my patients, keep a log as to what happened day 1, day 2, or any of these, so you can keep a track record as to how you have improved. So what have you noticed post-op?
I've not really got much pain at all.
Not much pain.
No pain.
No, I don't remember. Did you get the Exparel or no?
Yes, I did.
Again, yes, you got
so
the Exparel. So that Exparel really works.
Oh.
Yeah, and so because it's a block for 72 hours around, so every surgery that gets done in the world should get Exparel, if you ask me, because if someone gets like a knee replacement, you should not be feeling pain, or a hernia repair or anything, a C-section scar. Everyone should, because why take the opioids?
Absolutely, I would really recommend that injection. It was great.
Yes,
absolutely brilliant.
What pain meds have you taken since surgery?
I had tramadol just the night of surgery, and I think I had 2 tramadol the following day, but that's been it.
So a total of 3.
Yeah. I had some paracetamol.
Yes. So that's the Tylenol.
Yes. I had some of them, not yesterday, the day before. I've had no pain meds since yesterday, nothing at all.
Yeah, and you will see after looking at your videos and pictures, you would think you would be at least in some pain.
Oh yeah.
But this has been consistently true. Now the other thing I want to mention is that, there's a mention about bloating in the group, and I saw this. So yesterday I reached out to a physician at the hospital when I was there, who's a gastroenterologist. He said, because I said, this is what a good number of my patients are going through this. He said just the fact that you get the anesthesia and you take the pain medications, that in itself will cause your gut to slow down.
Right. Okay.
So what you want to do is gentle walking, slow motion walking is going to help with return of the bowel.
Yeah.
Because remember, the bowels have peristalsis. Eating high fiber diet, lots of fruits and vegetables. Number 3, Miralax. Something fiber, Metamucil, that really helps keep you going so you're not constipated. And then sometimes I feel like, you hit the irritable bowel syndrome.
Yeah.
So a lot of now I do not know the details, but I will tell you the BII symptoms, they affect from head to toe.
Oh.
Some hair loss, some migraines, some dryness of the eyes, some GI tract. Look, you had the irritable bowel. We do not know. It's too early to tell. Just you traveling here is going to change your bowel habit. But if you ask me anecdotally, this is not any different from the literally, I would say, thousands of other surgeries I've done, and those patients were not bloated. Sometimes you think it's the antibiotics. No. Look how many kids get an ear infection and they take antibiotics and they're not bloated. Sometimes the anesthetics, they're out of your system in 24 hours. So if you ask me deep down within, there is a component of this BII. What it is, I do not know. One thing I want to mention here is actually 2 things. All of the capsule was removed and all of it is being tested. Would I change any of that? Absolutely not. Now, is this, quote, a side effect, a bloating that is occurring in my patients? Well, I have to give the antibiotics because there is a biofilm around, and the pain meds, you need it. Now, Exparel hopefully will minimize pain medication usage. You ended up not taking the Norco. So that Norco is notorious for causing constipation. Now, what would you say what other symptoms have you noticed improvement upon?
Well, I do feel a wee bit more energized, but it's early days, I suppose, but I do feel as if I've got a bit more energy. Leg pain has gone. I used to have heavy, weak legs, and that's gone, and they were really, really sore. Soles of my feet were really painful, that's gone as well.
Wow.
So, I don't know.
Yeah, now this is what other ladies have mentioned. Now, this is what we're going to do. I am very grateful to you for coming forth and sharing your journey. We want to go ahead and maybe at the 6-week, 8-week mark, we will go ahead and take word off that we will do another follow-up, just so that we can follow your post-op course. You have been truly wonderful in your T-Rex arm movement, so God bless you for doing that. If anyone says to you, this is a placebo effect, this is all in your head, what would you say to that person?
Nonsense. It's absolutely not. Absolutely not. And I just feel as if we should be heard and we're not getting heard. It's just, I've spent years and years going back and forth to my GP and just getting brushed under the carpet. symptoms were getting worse. It's not in her head at all. 100% not.
Right. No, I just want to mention that this is a known problem. This is not a surprise. And I just, again, not my words, but the words of the manufacturers. And this is, again, the advertisement. It says, I'm going to read off two things and then I will let you finish. Quote, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, which are the hallmark features, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. So I humbly and professionally request your GP, if anyone comes back with fatigue and they have implants, they need to look into this. The other thing I want to mention here is that if you look at, again, the same FDA guidelines for better communication, it says over here, I understand, and they want the patients to initialize here at the bottom. Quote, I understand that some patients who receive breast implants have reported a variety of systemic symptoms, including joint pain, fatigue, memory loss, and brain fog that some people have called breast implant illness. Unquote. I just say it's shameful that some people have. You can call it too. You're not going to get into trouble by saying it. While the causes of these symptoms are unclear, some patients have reported relief of these symptoms with removal of the implant and surrounding scar tissue capsule. So they're saying capsule removal. However, not all patients may experience improvements in the symptoms, because sometimes if it has spread to the lymph nodes, into the other parts of the liver, body, if you will, lungs, no matter how much you remove, there is badness remaining behind, and those patients do not seek improvement. Now, the bottom line is this is a known problem. I didn't write that. This was established. This is back when in 1992 when the silicone implants were banned. So this is the same problem repeating and recurring in itself. And the bottom line here is the patients are not listened to. Their complaints, if you look at the complaints you have, it is pattern recognition of problems that the patients come in, joint pain, hallmark problems. You have tingling, numbness, and down in the legs. You have, again, all organ systems, some more, some less affected. And it's the same story that repeats itself. You are as human as anyone in any part of the world. In the United States, 400,000 women get implants. And I'll tell you, eventually, because they're not lifetime devices, as you heard, there will come a time sooner or later that they're going to have problems. Charlie Sheen's daughter is smart and wise enough to realize at year 3 that these are the implants, and she's now wanting to get these out. And you know what? I want her to speak, and I want her, when she gets an explant, she speaks her mind, because people are going to listen to her. And this is a real problem with a real solution.
Yeah, definitely.
Yeah. What did you say to those patients? Now, I find it very interesting that of all the surgeons between France and Germany and England and Scotland, Ireland, and New York and the rest of the world, you had to come to me.
Yeah.
Why?
Because you're the best.
Why do you say that?
Just because I've watched all your Facebook lives, and you're so thorough, and you do not put implants in, and that speaks for itself. The fact that you don't do that. Every surgeon I've seen for the explant, they still did the implants as well. They still done that surgery. I just knew I was coming to the right person.
Thank you
Yeah,
very much. No, thank you very much for coming on. We wish you a safe trip tomorrow back home. We are very, very grateful to you for expressing and sharing your journey, because there are, I would use the word, millions of ladies out there who have implants who are hurting, and they do not know if this is the underlying culprit. I may have asked you this, but last question on my end, and I will let you finish.
That's okay.
Was there a part of you was saying, don't do it, don't come?
Yes, absolutely. But I knew I had to. I knew. Even the morning of the surgery, I was so nervous, and my anxiety was through the roof. But I just knew I had to do this. I knew this was my only way of getting better. So I knew I had to do it. And just the whole experience was fantastic. It really was fantastic. the whole team here are wonderful. Even your nurse Emily and Marlana as well. All been very, very a great team.
Thank you, thank you,
Tremendous.
thank you.
Yeah.
Please say any final words.
I just think for anyone who's kind of sitting in the fence thinking, you know, is this in my head or is this could this be related to my implants? It probably is related to the implants. I would say don't think about it for years like I did. Go and get them out. Sooner you get them out, the better you'll recover. The quicker you'll recover. Absolutely.
Sure. I will finish with this anecdote. You know, when you first came in and I knew you were coming, you know, and you said, hopefully you can understand me. I said, no, my chemistry professor was Mr. Clark, and he was from Scotland. So initially we had the hardest time understanding the accent. But then after some time, I would tell you, we mastered it. And I remember this was in grade 7, by the way. And so you're looking at, believe it or not, 1985. All right, so 1985 for me. And I remember walking up to him and, you know, we were like trying to decide what we're going to do in our life. And, you know, we're like very career oriented. You know, in our school, it was the best school, I would say, the private school. And I asked him, what should I do when I grow up? And I remember asking him, and for whatever reason, it stuck to my head till this day. And I said to you, and he told me, no matter what you do, be the best at it. So number one, no matter what you do in your life, you want to be a musician. This was the example he said, you want to be the best you can be so that there is no competition. No matter what you do, be the best at it. And this is what is so true. You know, one of my mentors, he's a chairman of plastic surgery. He trained me. He said, when you have a transmission problem, you go to the transmission expert. We do cars here, so we give examples with cars. You do transmissions from 8 in the morning till 5. That's all what you know. You do nothing about brake jobs. You know nothing. I know nothing about rhinoplasty. But one thing I said I'm not going to do is implants, because I knew very early on they only hurt. And then when the opportunity came for me to explant, and in the manner that we have done, this is where I've said there's a certain etiquette into removing. So as you head back tomorrow, you have that utmost peace of mind that, you know, you got the best surgery that in 20 years that I cannot imagine anyone else will do anything different. So.
And I only wanted to do it the once. And I know you
do
always say that in your Facebook page. You only want to do this the once.
Do it once, do it right, do it definitive, do it with the peace of mind. So when you put your head on the pillow, you have a smile that you have that confidence that everything was done right.
Absolutely.
Thank you very much. Appreciate it. Please, we have another Facebook Live from a very, very young patient, young mom, and I am looking forward to doing that. It will be very exciting to share her journey. Again, this is a movement by the ladies, for the ladies, so that you help each other. You know, I will say this, this is something that all of the ladies who are hurting can relate to you, just like you did. And do your homework, do your research. The answers are out there. Thank you very much. This was very good. We covered a lot.
I felt quite nervous.